Whiplash is a condition that describes a high thrust, high velocity injury to the cervical spine that generally damages soft tissue such as muscles. In extreme cases, you can get cervical fractures, typically around the upper cervical region, the ilanoaxial joint, even fractures of the dens itself. But generally, this will affect just the soft tissue, meaning the muscles and the fascia. In the case of whiplash, we tend to think of the most traumatic situations, which would be car wrecks. But even things like mild and certainly high activity sports where there's contact or falls involved, or situations where, even recreational things like going to shows, jumping on trampolines, these things can create micro whiplashes over time that can lead to some of the similar symptoms you see with traumatic whiplash. Obviously, in those cases, the symptoms will be relatively mild compared to extreme car wrecks where very little manual intervention is pursued. They typically immobilize the area until recovery is considered optimal, and they are released with zero rehabilitation post-recovery. And with all that immobilization, typically scar tissue and muscular hypertrophy occurs. So manual therapy is a wonderful way to intervene and get some of that range and, most importantly, reduce the symptoms. It's really important to get a handle on the direction of whiplash, whether it's A to P or P to A, meaning if it's A to P, it's going to be a hyperextension whiplash, and if it's P to A, it's going to be a hyperflexion. There's also impact-related whiplash, which tends to sublux the vertebrae one against the other in translation. This is usually due to rear end collisions that are high impact with airbag deployment. Symptoms generally include chronic posterior neck and occiput pain, chronic headaches and migraines, dizziness and vertigo. Beyond that, just making sure that there aren't any symptoms that are a result of concussions, because whiplashes in high impact situations can often be accompanied by concussions.